Hello, Quail Hill staff. My name is Will Vaughn. I'm the Health and Safety Chairman for the Monmouth Council Boy Scouts. I'd like to review for you, in advance of our camp, some first aid procedures, emergency procedures, bloodborne pathogens, and procedures for dealing with COVID-19, of course. So the first thing I want to speak about is COVID-19 in general. We've done a lot of preparation to make sure that the camp you're about to staff is safe. Your in-person training will include a more extensive discussion about social distancing, how to cohort the pods of individuals that are participating in this camp together, the need to wear face coverings when you're getting closer than 6 feet to people, and also procedures for cleaning and disinfecting facilities and equipment. So please pay close attention to that when it comes up. One of the most important procedures that we're using in order to keep our camp safe is asking folks to stay home when they're sick. That includes you, and also doing some medical screening on everybody's arrival to camp. So on arrival to camp, led by the health officer, there will be a non-contact temperature check using an infrared thermometer, and also a discussion of the BSA's pre-event medical screening questions that you probably become somewhat familiar with from other places, like do you have a fever, have you had a cough, that sort of thing. It's very important that if you were to become sick during this camp, let the camp director, Mr. Buab, know as soon as possible so he can give you some direction on staying home and also make provisions to cover you for your program. So that's our procedure. The protections with respect to social distancing and wearing masks applies to first aid as well. But let's take a step back and I'll discuss briefly what the big picture is with respect to first aid. So we will staff a health officer who's an EMT every day in Last Lodge. They're at your disposal. I think it's going to be a largely older crowd that you're dealing with, the buckskin folks probably being an exception, but I'm optimistic that our volume of medical problems is going to be relatively low because there's no overnight component, people aren't away from home, they're in a situation where they can manage their medical problems the way they do at home, more or less normally. If somebody has a minor medical problem, you can send them to Last Lodge, send them with a buddy. The buddy should be a member of their same pod or cohort, so another scout that's in the group or a staff member who's been cohorted with the group. If you have to send them with somebody who isn't part of that, then they should both wear their masks, and that's kind of the guideline for everything. If there is a medical emergency in the field where the person should not be moved, let's say they fell and there's a potential for a head or neck injury, or they broke a bone, or you're not sure, then go ahead and send for help by the prescribed procedure, probably by radio to the health officer in Last Lodge, and help will be sent to you. The medical emergency procedure in general is, number one, you'll assess the situation and you'll use the materials in the first aid kit that's in your program area. That first aid kit includes things to deal with minor injuries, so there's band-aids and so forth if you need them for, very minor things. And then there's also things to deal with more significant problems like materials to stop bleeding, including gloves and face protection and that sort of thing. So if you were to have a serious medical emergency, you'd get on the radio, describe the situation, and help would come to you. We have, as I said, an EMT at Last Lodge. We have another EMT who's the aquatics director at the pool. And we have, of course, our ranger who is in charge of the overall emergency response, including how to figure out how to bring help to the patient or how to bring the patient to help. Anytime there is a response into the field, and this is something that I always cement with our health officers, our rangers, our other emergency responders, if we hear of a problem and we send help out, let's say from Last Lodge, we always bring jump bag, which is our big emergency kit, an AED, a defibrillator, and we bring a communication device like a radio, a cell phone, or both. We never want to be in the position where we've gotten to the scene of an emergency and it turns out to be worse than we expected, and there's a piece of equipment that we should have brought with us. So that's our rule. So if I can give you an example, let's say you're at the pool and there's a report of someone having a medical emergency in a car in the Lawrence Lodge parking lot, then you would bring a first aid kit, an AED from the pool, and you would bring a communication device like a radio with you, and that way you could call for additional help. You could deal with the most life-threatening of problems, including bleeding and cardiac arrest, and you're not in a position where you'd have to run back for something. So with respect to protecting yourself, I'll get into the bloodborne pathogen rules a little bit later, but in general, because of the COVID-19 concerns, we're going to start any situation by observing from a distance. And this is probably not a lot different than you're used to, because the first thing we teach in first aid is scene safety. So get the big picture, see what's going on. You can speak with the person from more than 6 feet away and get an idea of what happened. When you need to approach the person, you're going to put your mask on, and then you are going to ask that individual to put a mask on if they can. If they are unconscious, you will put a mask on them as well. You will do that with your gloved hands after you put your own mask on, just like an airplane. If for whatever reason the patient is not breathing, this year, and this year only, we will adapt our emergency procedure and we will do compression only CPR. So the person is not breathing and they don't have a pulse. We will put a mask on them and we will put them on their back and we will do compression only CPR. Compressions like you've been taught in the past, either through CPR courses or your scouting experience. You're going to press up and down nonstop on the center of their chest, between their nipples, on their breastbone, nonstop until help comes. We're not going to use a pocket mask for ventilation this year, because a pocket mask generates aerosols and it requires you to take your mask off, and it requires the patient to not have a mask on. So that's important. The device that we're going to use to ventilate someone who is not breathing or doesn't have a pulse is a bag valve mask resuscitator. We have them in the Ranger's truck, we have them at the pool, and we have them in the jump bag at Last Lodge. So it will be compression only CPR until that an individual shows up with that equipment. In general, we will use the fewest possible people to address a medical problem. So this is not the type of situation where somebody has a complaint and we're going to cluster 6 staff members about them, firing 30 questions at a time. We're going to send one individual, ideally the most highly trained person available, to assess the situation closer with a mask on them and a mask on the patient. Of course, there are exceptions to this. If we have to move somebody or if we have to run a cardiac arrest, there will need to be more people. But again, that's kind of the big picture. Fewest people as possible, assess from a distance first. Everybody masks on, including the patient and the rescuers. So generally, you're going to see, an emergency phone call will probably be made by either the health officer or someone they designate, probably the camp director, something like that. In the event that you are asked to make an emergency phone call, we use a landline. There are emergency phone numbers posted next to the landline. At the top of that emergency phone number sheet is the address and the telephone number of the camp. When you call 911, the first question that the dispatcher will ask you is, what is the address of your emergency? The reason that they ask that first is in the event that the line gets dropped or somebody hangs up, at least they know where to send help. So the first thing you'll say is your Quail Hill Scout reservation, and then, as I said, the address will be at the top there. Then they'll say, what number are you calling from? You will give the camp phone number, which is underneath that. Then they will ask what's going on. You'll describe to them what's going on. You will likely not be at the scene of the emergency if you're making this call. So you want to make that clear, because when they start asking you many, many specific questions about what's going on, you might have to clarify, look, this is what I know. Pass along what they need to know in order to determine the appropriate emergency response. Do you just need an ambulance? Do you need paramedics as well? What's the story? How bad is it? And where are you? One of the responsibilities of the ranger and the camp director is, once there is a qualified team taking care of the patient, they're going to need to figure out, okay, who's going to meet the ambulance at the front entrance, direct them to where we are, how close can they get to the patient given the road situation that we have, is there a possibility we have to bring the patient to the ambulance? That's something that they will deal with. Okay, let's talk about a couple of specific first aid situations, the first being bleeding. If someone is bleeding, in all likelihood, it will stop with direct pressure. First thing we want to do, again, our mask on, patient's mask on, gloves on, eye protection if necessary. We're going to put consistent direct pressure on that wound with some gauze from the first aid kit in our program area. We're going to hold that for a consistent period of time, probably at least 10 minutes before we even look and see what's going on. If it is a catastrophic amount of bleeding, we're going to put pressure on that, and we're not going to let up. We're going to call for help. If it's a more minor amount of bleeding, we're going to put some pressure on it. We're going to wrap it up with a gauze bandage so that that pressure maintains. Usually the reason the bleeding doesn't stop is that we take the dressing off, we disrupt the clots, and we have a look and we say, oh, it's still bleeding, and we put it back on. Same principle kind of applies for a nosebleed. You know, if you really sat down with a nosebleed, leaned forward, pinched the nose, and sat for 10 minutes, 99% of nosebleeds would stop during that time period. If there is a catastrophe, a chainsaw accident, some type of arterial bleed where that blood will not stop coming out, then we're going to go directly to a tourniquet as soon as one's available. If you know how to do it, you can improvise one with a cravat from the first aid kit in your program area. Our preference is to use commercial tourniquets. So there are commercial tourniquets available in a number of places. The Ranger's truck, there's one with the AED in Lawrence Lodge. There's one with the AED at the pool. There's one in the jump bag at Last Lodge. So we've got some opportunities for that. If you're an emergency responder and you get to the scene and you see that an improvised tourniquet isn't working or direct pressure has been used and there's still blood everywhere, then please don't hesitate to put a tourniquet on an arm or a leg. It is not like it used to be. It is not going to be harmful in the long run. What's harmful in the long run is somebody losing enough blood to die from shock. What else are we going to do with someone who's in shock? Well, we're going to put them flat. We're going to try to keep them warm, and we're going to get help as quickly as possible. So severe bleeding really is our first concern, because somebody can die in minutes, sometimes even in seconds, depending on how significant the bleeding is. Our next real priority is breathing. I already discussed this briefly, but if somebody is unconscious, we're going to assess whether they're breathing or not. Unlike in the past where we get up close and personal, you know, head down to their mouth to look, listen, and feel. Instead, we're going to look at their chest to see if they're breathing, and we're going to see if they have a pulse. If they are in cardiac arrest, as I said, we're going to put them on their back. We're going to start compression-only CPR with a mask on them. If they are breathing but they're unconscious, we're going to roll them into the recovery position and arm up, right, rolled over onto their side. All right, bear with me as I move through my agenda here. Choking procedure has not changed. We're going to use the Heimlich maneuver. So if somebody is choking on food and they cannot speak, they cannot cough, they cannot breathe, we are going to go up to them, verify that they are choking. This is the universal sign of choking. We're going to move around the back of them. We are going to position ourselves such that we have 1 foot forward and 1 foot backward so that we're stable in case they fall on us. We're going to reach around them just above the belly button with a fist, grab that fist, inward, upward thrusts until the object comes out or they become unconscious. If they become unconscious, then it's compression-only CPR. Again, we'll call for help as soon as this happens. Severe allergic reaction. There are a fair number of folks, both scouts and adults, who have life-threatening allergies. They could be to bee stings. They could be to types of food like nuts, nut butters like peanut butter, shellfish, which doesn't tend to be part of the menu at camp, but hey, you never know what they're bringing. So if someone were to be exposed to that and they started having symptoms of anaphylaxis, sometimes called anaphylactic shock, you would see swelling of their airway. You might see their lips and their tongue and their face swell. You might see them have difficulty breathing because they're trying to squeeze a lot of air through a very tight throat. You might hear them wheeze. You might see them covered in hives, you know, kind of like an itchy rash all over the body. Or you might see them develop shock, meaning they're pale, cool, sweaty, you know, weak or absent pulses in the wrist. They might be confused or, you know, just not even there with a 1,000-yard stare. So you'll get them into a position of comfort for breathing, or you'll put them flat on the ground if they're shocky, and we'll assist with an EpiPen. If this is not something that you already know how to do, in this situation, I would ask you to enlist somebody who does. The EpiPen itself is straightforward to use, but you need to have seen one before. So call for help right away. Let's track down the patient's EpiPen and we'll assist with it if you know how. Okay, head and spine injuries. We have a little more confusion about this than in the past, just because, you know, once upon a time, if somebody got their bell rung, if they got struck in the head, you know, we'd put them right back in, you know, back in the game, back in the scouting activity, what have you. Now, if there's a significant blow to the head such that they have symptoms, they're dizzy, they're confused, what have you, we don't put them back in. We get them cleared medically. So if you've got somebody with symptoms of a concussion, they need to be evaluated by the EMT in Last Lodge. If it's a real significant head injury, like they've been knocked unconscious, or there's a very significant mechanism of injury, they fell off the roof, there's a possibility that they have a spine injury because they have severe neck and back pain, or they have numbness and tingling in their arms, they're paralyzed, what have you, we leave them right where they are, call for help. We'll bring help to that person. If for whatever reason they are unconscious, then same as I demonstrated before, we can roll them into what's called the recovery position, arm up, rolled over on their side, the arm supports the head so the neck's in alignment. The only exception to moving someone in one of these cases is if someone has a concern for spinal injury in the water, in which case the staff at the pool will manage the situation, utilize the backboard for extrication of the patient from the pool. Okay, bumps and bruises. You've got some ice packs in your first aid kits for things that are kind of trivial. If somebody has another problem that concerns you, send them on to Last Lodge and let the EMT there evaluate it. In general, anything that we suspect might be a fracture, or if we're not sure, leave them where they are, ask for help, and someone will come out and have a look at them, and we'll figure out how to get them where they need to be, whether we need to get a vehicle and help someone with a sprained ankle get where they need to go, or whether we need to put a splint on and send them to the ER, or whether it's more serious than that and we really need an ambulance to manage it. Small cuts can be washed with soap and water, or there are some antiseptic swabs in your first aid kit. There is triple antibiotic ointment and Band-Aids and things like that. If you're not sure about just how bad a cut is, please don't overthink it. Just send it on up and we'll deal with it. Any first aid that we give needs to be jotted down and then shared with the health officer at the end of the day so that it can go in our log. So you're going to need to know the scout's name and then the particulars of what went on. If there's a burn, cooking class, what have you, minor burn, put it under running water immediately, ideally within 30 seconds, if that's possible. Pour water on it from a water bottle or a canteen, put it under running water. Anything you can do to get it cooled off right away. If it's real minor, you don't see anything when that's all done, then fine. Just make a note of it and we'll put it in the log. If it's more serious than that, it needs to go and be evaluated by our health officer. Real extensive burns, somebody get caught on fire or something, God forbid something like that happens, it's an emergency. Like, go ahead and ring the bell and, we'll get some folks to deal with it on the scene. Something in the eye, just send it on up to Last Lodge. We'll get it washed out and evaluated. Nosebleeds, as I alluded to before, have a person sit down quietly, lean forward, pinch the bridge of their nose, don't stop for 10 minutes. If it won't stop at that point, send them on to the health lodge and we'll deal with it from there. A couple of types of sudden illness. One is a heart attack, probably somewhat familiar to you, most likely in an adult, but not out of the question in a kid. Most likely presenting sign is severe chest pain, often radiating to the neck, jaw, the left arm, often associated with sweating, shortness of breath, nausea, things like that. Any suspicion of that, call for help. We will send help to them. If there's not an AED available at the site, send for an AED as well. This is one of the reasons why we bring an AED anytime we respond to an emergency in the field. One of the things that we do now is we offer the adult with chest pain aspirin. This will be done by our designated responders, our health officer, our ranger, what have you, and it's in those appropriate kits. Okay, stroke. Stroke is a sudden paralysis, usually on one side of the body. It's because of obstruction of blood flow to the brain, unlike a heart attack, which is an obstruction of blood flow to part of the heart. We'll put the patient in a position of comfort. We'll take note of the time that it started, and we'll send for help. If the patient can't sit, they can lie on the ground in the recovery position, again, on their side with an arm holding up their head. That helps fluids drain out if they're having trouble swallowing. Okay, asthma. Asthma is a relatively common medical problem among the youth in the program and also among some adults. What it means is that when a certain trigger is encountered, and it could be exercise, it could be a type of allergen, what have you, it will cause a rapid constriction of the bronchi, right? We know the trachea or the windpipe comes down towards the lungs, splits into two bronchi, which connect to the lungs. Those bronchi constrict in an asthma attack and make it very difficult to breathe. Makes it difficult to breathe in, makes it even more difficult to breathe out. Most asthmatics will carry a rescue inhaler with them. The most common medication there is called albuterol. So the first thing that we want to do is we want to get them in a seated position where they can breathe more easily. We want them at rest, and we want them to use that inhaler. So if it needs to be found, then we need to find it and get it to them. If that doesn't make things better right away, or if things get significantly worse, we need to call for help at the earliest possible opportunity. When I say things get worse, I mean the patient can't speak, their lips are turning blue, they don't seem to be moving air. We don't want to, get to the point where they stop breathing and we haven't even begun the process of securing help. The treatment of asthma that doesn't respond to the inhaler often involves medications that only come via 911. So we want to get that process started early if the basic inhaler didn't solve the problem. Then we have diabetes. Diabetes is a problem with managing the metabolism of sugar. Your pancreas makes insulin, and when someone's pancreas doesn't make insulin, they inject it into themselves several times a day. Or if they're an adult with diabetes, they might take pills to help deal with the balance of sugar and insulin. If something goes wrong with this process, it's very often because the blood sugar is low. There's too much insulin and not enough sugar. This happens in camp with some frequency among diabetics because it's a different situation than they're used to. There's a different eating situation. They may be more active and burn off more sugar. There may be other things going on. But in general, if there's someone who has diabetes, you either know they have diabetes, someone tells you they have diabetes, or they have a medical alert bracelet on that says they have diabetes, and they are not acting right, we assume that their sugar is low, right? So recognize that, call for help. We carry glucose gel in our major first aid kits, specifically the jump bag and last lodge, and the one that the ranger carries. So we can give that to a diabetic who is confused as long as they're awake and able to swallow. But again, we're going to wait for help for that. Okay, the last medical problem that I'd like to talk about is seizures. So it's somewhat common, especially under the situation where scouts have developmental disabilities, where there's a history of seizures. If someone has a history of seizures and they have a seizure, it may not necessarily be out of the ordinary, but it's something that we will still call for help. Right? Let the health officer for the camp evaluate that situation, and if necessary, they'll call a parent or what have you to have a discussion about, hey, is this normal? Would you normally, send this kid to the hospital for this, etc. If somebody's actively having a seizure, the most important thing you're going to do other than call for help is protect them from injury. You don't want them to hit their head on the concrete deck of the pool or the floor of a building. So what you want to do is you want to get them on their side, and you want to have something under their head so that they don't hit their head on the floor, and you want to move furniture away from them, you want to move people away from them. Usually the seizures don't last very long, but you want to make sure that you protect them from injury during that seizure. In addition, it's important to know when they come out of that seizure, there are two things that are likely. One is that they will be confused because their brain has gone without oxygen during that seizure, and it will take a number of minutes for that to normalize. The second thing you need to know is it's not unusual to be incontinent of urine during a seizure, which is pretty embarrassing, but not unusual. It's not their fault. So again, it's another good reason to keep people away. Any seizure, we're going to call for help. As I said, a seizure with a history is not necessarily as significant as a seizure that happened with no history of epilepsy. So somebody has a seizure out of nowhere, or a seizure that doesn't stop, or they fell off the roof and hit their head and now they're having a seizure. Those things are very ominous and we need to move quickly. Okay, heat and cold you probably know quite a bit about. Hypothermia is obviously from exposure to the cold. It's not out of the question in a summer setting, especially if it's raining and people are wet. So you want to make sure that if people are suffering the effects of cold, that you get them into dry clothes and warm them up. In general, with any heat or cold emergency, It goes from bad to worse uh, when there's altered mental status, when somebody gets confused. So that's kind of our danger point. That's the point where, we haven't been able to successfully treat it on our own and we need to call for help. So that's kind of the same for heat problems. If somebody starts not feeling well with the heat, get them into the shade, we get them into the air conditioning, we have them drink some water. We see what's going on. If somebody's in a situation where their mental status changes, they start getting confused and they're hot to the touch, even if they're still sweaty, then we're concerned that they may have progressed to heat stroke. That's a medical emergency. We need to ring the bell and get help to them. Okay, so that is first aid in general. I want to speak briefly about a topic called bloodborne pathogens, and I've spoken about some of the procedures for this first, but I want to speak about the OSHA bloodborne pathogen standard in particular. So OSHA is the Occupational Safety and Health Administration. It's part of the federal government. They write rules to keep workers safe at work. A lot of what we do at camp is in compliance with federal standards on safety at work, and that's everything from fire extinguishers and personal protective equipment through things like first aid. There is a standard called the OSHA Bloodborne Pathogen Standards, and based upon that standard and also the BSA camp standards, we speak about this in particular. So a bloodborne pathogen is a germ that you can get by exposure to somebody else's blood or bodily fluids. The ones of particular concern to us include HIV, which is the virus which causes AIDS, and also the various types of hepatitis. So these can cause significant lifelong problems, and we want to make sure that we take every precaution to protect people from getting this, whether it's through first aid or cleaning up blood spills and things like that. So we have a number of procedures to deal with this. One is that we have what's called an exposure control plan, which is on file in the office. At Last Lodge, you are welcome to review it if you wish. We have designated emergency responders to do the lion's share of first aid. So those folks in particular are the ones with the higher level of training for this. Rather than giving incidental first aid in an emergency, they're the ones who we try to, send the folks with medical problems to as the primary providers. Those people in particular have to have hepatitis B vaccination, or they need to sign a declination statement saying that they don't wish it. Any other staff member who incidentally gets a significant exposure to blood or bodily fluids would be offered hepatitis B vaccination after the fact if there's been a significant exposure. The good news is that the overwhelming majority of people have received hepatitis B vaccination since this law first came into effect during the early 90s. It was relatively rare then. The other thing is that the amount of exposure that you need in order to constitute an exposure for the sake of bloodborne pathogens is significant. So your intact skin is a good protection against blood. So blood on intact skin is not an exposure. It really needs to be blood either through a needle stick or sharp object, a cut with blood that comes in, or it needs to come into your mucous membranes. You need to be splashed with blood in the eyes, in the nose, in the mouth, something like that. If we're using our personal protective equipment appropriately, it is very unlikely that that would happen. So what personal protective equipment do we stock? Well, every first aid kit in camp has a couple things. One is gloves. Another is eye protection in case there's spurting blood. Our eye protection in this camp for the most part is fluid shield masks, so it would protect your mouth, nose, and eyes. In this COVID era, you're going to have your mask on no matter what when you're giving first aid. So that's going to protect your mouth and your nose, which is a good thing. And if there were spurting blood and you don't already wear glasses, then you would put on the eye protection that's in the kit. So that's available to you. If there were an exposure of some kind, let's say you did get stuck by somebody's EpiPen after it was given, or let's say you got blood spurted in your eyes while giving first aid, then you would take whatever steps necessary to limit that exposure, washing out the eyes, squeezing the wound where this happened, trying to get whatever that is out, and then you're going to report it to the health officer who will follow up with our camp physician. So in general, given those precautions, the risks of exposure to bloodborne pathogens are low, but it is important for us to discuss it regardless. So I believe that is what we need to cover today for the sake of the medical response to COVID-19, medical emergency procedures in camp, the basics of first aid, and the OSHA bloodborne pathogen standard. I thank you all for helping out during this unique program. I think it's going to be a lot of fun. I wish you well. And if my committee can give you any particular support during this, speak with the camp director and or the health officer, and we'd be happy to help. Take care, everybody. Have a good summer.